Good morning and welcome to our first Facebook Live of the spring 2022 semester. My name is Jack Kofer and I'm an undergraduate student studying integrated strategic communication here at the university. Today we are going to be talking about taking control of your own health. With me, I have Becky Dutch and Venditto, two experts who are extremely well equipped to answer some questions that we have for the health and safety of our community. Becky Dutch, Vice Dean of Research for the UK College of Medicine, is a virologist studying the diverse nature of viruses and a professor of molecular and cellular biochemistry. Venditto is an assistant professor in the UK College of Pharmacy with expertise in cardiovascular diseases, immunology, pharmaceutics, and liposomal and vaccine delivery, including COVID-19 vaccines. Thank you both for joining me today, and let's jump right in. First, can each of you give us some more background on what you do here at the university?
So I do a variety of things. My role as Vice Dean, I help oversee the research of the College of Medicine, which is a very large amount of research because it's an extremely active group. We have 1,300 faculty in the college. We have a lot of both clinical and basic science research. I also run a lab, an NIH-funded lab that looks at RNA virus infection, particularly RNA viruses in the respiratory tract. And then I do also teach. I teach virology in the fall. I'm a co-teacher of that class, and then get to enjoy all sorts of other interactions with faculty, students, and staff.
And Vince?
Yeah, so I'm an assistant professor in the College of Pharmacy, and so I have a research lab where we focus on cardiovascular inflammation and trying to modulate immune responses after heart attacks, for example. When the pandemic hit, we kind of pivoted a little bit to start to study COVID in the community and working with our pharmacists to try and figure out what COVID looks like out in the community and what infection rates with SARS-CoV-2 are like out there. So that all that is ongoing. I also teach in the College of Pharmacy, so I teach our PharmD students rheumatology in their second year. So all the future pharmacists will see me in the second year of pharmacy school. So.
You were talking about infection rates. A question that I actually have, Becky, would you help us understand the Omicron variant? What do we know about the transmissibility, severity, illness, and hospitalization rate?
Sure. And I think it's really important to point out when I start answering the question that everything we're learning is continually evolving. This is quite a new variant. It was really not identified till November. So each week we're learning new things. So what I'll tell you is what we seem to know now. So Omicron appears to spread much more rapidly. We're seeing that in a lot of communities. The suggestion has been that it is more transmissible. The challenge being we don't really have the data yet to say why. Is it actually, say, more stable? Is there something about the virus itself that makes it more transmissible? There's been suggestions it may replicate better. You may have more of it up here in your upper respiratory tract, which makes it easier to spread it. Mm-hmm. It also appears that there's enough mutations that you have an increased likelihood that you'll catch it even if you previously had a COVID infection or if you've been vaccinated. So we see more cases of people who've had that. Now in many cases those are quite mild infections, but those people could still spread. So that might also be contributing to the enhanced spread that we're seeing with Omicron. So that's the first thing. We certainly see it moving through the communities very quickly. What about severe illness? Well, the very good news is that people who have been vaccinated and boosted or vaccinated, just even the first set of vaccines, we're seeing real reductions in the severity of illness. If I look at the data that's coming out of a UK hospital, we have a lot of people in the hospital still who have been identified as having COVID, including vaccinated people, and apparently in many of those cases for vaccinated people, they're in for something else, and when they test them, they realize they have COVID. But the ICU rates are actually a lot lower than what we saw, so at least so far, in, say, the way we dealt with in September with Delta. Mm-hmm. And that's good news because the thing that vaccines were meant to do is to keep you from getting really sick or dying. And I'm sure we would all agree that if we need to, we can go through, for many people it's mild, it's sniffles and stuff, but what we don't want is people ending up in the hospital or dying. Right. So now I do want to point out that doesn't mean that everybody who gets an Omicron infection is really mild. Some people feel pretty crappy. And if you've not been vaccinated and you've not had it before, it can still be really serious.
Thank you. And then you touched on this, but some have suggested the possibility that those who are double vaccinated and boosted are more likely to contract COVID-19, especially the Omicron variant. Is there any validity that would support this claim?
No, there's not. So one thing I want to point out is when the vaccines were developed, they were really developed to prevent hospitalization and death. They weren't really developed or tested to prevent transmission. So even if you're vaccinated, it is possible to still get infected. It's possible that you can still transmit. We hope that the vaccine helps lower some of that, but it's not guaranteed. What it's really designed to do is to keep you out of the hospital and to keep you off the ventilators. And so that's really what they're doing. And even with Omicron, it's doing that. Just like Becky just said, the people in the there's not as many people in the ICUs, and you know the hospitalization rate is down relative to what it was for Delta. So by all accounts, the vaccines are doing exactly what they're supposed to do, and that is to prevent hospitalization and death.
But there's certainly absolutely no evidence that being vaccinated makes you more likely to catch this. None
Correct.
at all.
That's good to hear. And then another point are there any risks to getting vaccinated to members in our community at all?
No, you know, they in the United States, they've given 250 million vaccines so far, and I think there's 80 million doses, booster doses that have been administered. So with those numbers, we really don't see very many adverse events. You know, you're supposed to have, you may have chills and fatigue and achy joints, things. I experienced all of those things. That means the vaccine's working. That means your immune system is turned on and it's doing what it's supposed to do. In some subjects, some people, you will have an allergic response, and if you know that you are allergic to things, then it's important to talk to your primary care provider, your doctor, your pharmacist, to actually make sure that you're getting the vaccine and you're monitoring to make sure that you're not having any of those adverse events that we are worried about. But it happens in such a small number of people. It's really not a significant concern. Certainly something to be aware of, though.
So probably the one other one I'll bring up, because I know people talk about this a lot. There is a very, very, very tiny number of people, particularly it looks like young men in their late teens, early 20s, who look like they have a heart issue after vaccination. The thing with that is that over and over again what happens is if they end up going in to be checked, they put them on basic things like Tylenol and stuff like that, and within 24 hours they go home. So I have 3 sons who are in the age range that would have been affected, and I was absolutely comfortable telling them to get vaccinated and boosted.
And the real issue with that is, you know, if you're infected, your risk of complications of heart abnormalities and all of those other side effects that you can get when you're infected are so much more significant with infection than with vaccination. So while there is potentially something that you need to be aware of with vaccination, if you're infected, the chances are significantly higher, and it's important to be vaccinated so that you don't have that issue.
That's a fantastic point of Vince, and one of the things I think it's important to stress is as we keep moving forward, as Omicron is rolling through, as we're going to see more and more, this is not a choice for people to be vaccinated or just not get it. It's really going to end up, you're going to get vaccinated or you're going to get infected without the vaccine, but you're going to get this virus in some way, or and it's how do you protect yourself?
And so you guys talk about the benefits of getting the vaccine. What are the benefits of students and parents to receive the booster for COVID-19?
So the booster, I'll be honest, when they first started talking boosters back in August, and I looked at the data, I thought, I don't know if we need to be boosted. Because there are also concerns for me in particular about making sure there's enough vaccine for the rest of the world, particularly Africa is at very low vaccination rates, and we need to really be working on that. I saw 2, in the end, I was boosted in early December, and there were 2 main reasons that I did it. The biggest reason, I was actually not worried for myself about hospitalization or death. The data really suggests that those first 2, I had the Moderna vaccine, that the first 2 shots was sufficient to keep me very well protected. But it was clear that over time, your chance of getting infected and spreading it seemed to go up some, it was actually surprising you were protected at all. Most vaccines don't do that in terms of any infection. Vaccines protect you from getting really, really sick. But because we're trying to reduce spread in the communities, because, for instance, at Christmas I was going to be spending time with my parents who were in their late 80s. I wanted to do whatever I could to minimize the risk that I would get a case. I wasn't worried for myself, but I didn't want to spread it on. And those were really the biggest reasons. It's the same reasons I encouraged my family and my children to go ahead and get the booster. In fact, they all expressed the same thing before they spent time with their grandparents. They all made sure they were boosted. They were all especially careful because we really still want to protect people as much as we can.
Mm-hmm. And then, Vince, you touched on this earlier, but how safe is the vaccine and booster for young adults and their parents?
It's safe. Like I said, they've given so many doses now. We really haven't seen any major adverse events or side effects that we wouldn't expect, that we didn't see in the clinical trials. So by all accounts, they are safe and effective. It really, there are some of those things that we brought up, like the heart complications, allergy, those types of things. They're important to be aware of, but they happen so rarely that most people who get the vaccine are not really going to have any of those side effects. So I can say that they're safe and effective, and I would certainly have any of my children or any of my nieces, nephews, anybody in my family, I recommend that they all get them. So that's what I've done.
That's great to hear. Yeah. And another question: when you talk about safety, Becky, you touched on it earlier with young men. There's a lot of concerns about young men around the age that I am. And so how safe is it for us, and should we be concerned about anything with our health?
I actually think it's extremely safe. I mean, when you give the kinds of doses, the 250 million doses Vince brought up, we often see if you have a very, very, very rare side effect, if you give something 250 million times, you will see some reports of that, and that's what we're seeing with this. It's an extremely rare side effect, but all accounts that I have read suggest that it's a side effect that goes away within a day or two and doesn't have any long-term effects. Certainly, if you're a young man and you have a vaccine and you start to feel like you feel heart, chest pain and stuff like that, call your doctor, go to the ER, make sure everything's okay. But with the frequency we see that, it's incredibly unlikely that you would experience it. On the other hand, as Vince properly brought up, the risks of those kinds of things happening, if you're not vaccinated and you get COVID, we see a lot of people who have long-term issues with heart, with lung, with other things. So it's choosing, do I want the incredibly small risk of a few days of having to get some treatment from this vaccine, or do I want the much larger risk when I get COVID?
I would get the vaccine.
Yeah.
And then concerns have been brought up surrounding infections among vaccinated people. So some individuals wonder why they should get vaccinated if it does not necessarily prevent them from contracting COVID-19. What would you say on this matter?
Well, like I said before, the vaccines weren't designed to prevent infection. They're really designed to prevent hospitalization and death, and that's what they're doing. So getting the vaccine, you can still potentially get infected, you can still potentially transmit, but really it's keeping you out of the hospital and keeping you, the side effects of the virus are so much more significant than any side effects that we see with the virus, and they're much more widespread. So, being infected, everybody is going to have probably be infected at some time, I suspect. This is not going away. And, when we think about boosters, we get flu boosters every year, right? We get the flu shot every year. It's really, you can think about that as an annual booster. And we should be thinking about this, I think, in a very similar way, that it really is, we're going to be living with this, you're going to be exposed to it. The vaccine is the easiest and safest way to avoid those complications.
And maybe it would help for people who are worried about this to think about what these vaccines do. So a vaccine essentially primes your own natural immune system to be ready to face something that enters the body. So that it shields from the outside, it primes your immune system so when that virus gets in, instead of you having to wait for the system to recognize it, to start building all these tools, the tools are there. So the initial infection starts up here, you get some particles in there, the virus is starting to grow. But instead of it taking days and days and days for your immune system to be able to fight back, it's starting to fight back almost immediately. So sometimes you will see an infection in a person, sometimes it'll progress more. but it's much, 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 much less likely to progress to a period where you're really, really sick. And that's the thing I think is really important to look at. It's doing its job. It's just a question of what the job is supposed to be. It's not a barrier on the outside. It's telling your immune system how to respond when the virus gets there. Sometimes it'll respond so fast, you'll never know that the virus was even there. That's what'll happen. Sometimes, and we see a little more of this with Omicron, the virus is a little teeny bit different, so it takes the immune system a little longer to really kick in and do all the protections it needs to. But it's still, if you're immunized, you're kicking in much, much faster than if you're not. And that's the thing to remember. What you're doing is providing your body's own natural defenses a tool to fight.
And so for those who may be hesitant to get vaccinated, what piece of advice would you give them?
I think, obviously the first thing I would say is just do it. I think the thing to do is to be really, really careful about who you listen to and why. I think it's very telling that if you ask experts who are infectious disease experts, vaccination experts, doctors, et cetera, you ask the people who work on the wards in pulmonary who are intubating people, not only are they all vaccinated, but they've pushed their families from the beginning. I know my brother said to someone who's hesitant, well, why should I trust your advice in vaccination? And my brother said, because the very first thing I told my 89-year-old father was the second you can get that vaccine, you get it. If we trust it in our families, if we trust it in ourselves, it's because we trust it.
Yeah, and I would say, there's a lot of reasons why people don't get vaccinated or they're concerned. And I think I would love to respond to every single question about, here's your concern and here's what my response to that is. But as one person, I can't actually respond to everybody even listening to this Facebook. And the questions that you've asked today are excellent, but they're not always necessarily addressing one person's individual concern, right? And so, but there's, physicians, there's healthcare centers all over the Commonwealth and certainly all over the United States and the world, right? And so, and there's pharmacies in every county in the Commonwealth of Kentucky. So if you have concerns, go to your pharmacist, go to your physicians, talk to them about your specific concerns and let them answer your questions. They're very well informed about the importance of the vaccines and what they're doing and how they're keeping people out of the hospital. So I think it's really important to reach out to those people that you trust and who have the medical information to be able to inform your decision.
Well, thank you both for answering all the questions that we have regarding the health and safety of our community. So thank you for joining me and providing the information to keep our community safe. And then thank you also to our viewers for joining us today. We hope you have a wonderful semester and stay warm, Wildcats.